You've been studying this for 25 years. I'm curious, in the next 25 years, where do you think this will evolve to? Where are we going? You've
Yeah.
hinted at it with what you've been describing, of course, but what are your predictions?
Yeah, I did allude to the idea that I believe that we have to allow more leaders to understand their role in supporting the health and well-being of the people they lead. There's no way that companies and organizations that, to get to that next level without embracing that their leaders are part of the solution. Folks like myself and the team that I work with, we can do a lot, but we can't do everything. And we are certainly not able to impact the day to day behaviors and emotions of the people in our work community. Now, if you're a leader or manager listening to this, you're probably like, I can't do one more thing. I'm being asked to get trained in this and I'm asked to be doing that. Obviously I'm biased, but if you look at the literature, it'll bear out the fundamental foundation of an organization's success is the health and well-being of the people they lead. And there are a variety of reasons for that. Uh, just the first one that I'll give you, or the only one I'll refer you back to, is the previous discussion about retention. If you don't have people on your team, then you won't have this problem about how figuring out how to. So once you create this well-being culture on your team, a lot of other management issues will start to disappear, including whether or not there's a challenge for your team to be more productive or more effective. Those things will fall into place. So, Scott, um, there is some movement on this front, but I believe this has to be the next big thing in order for us to move forward.